Hello, everybody. Happy Friday. We're at the end of another long week. I'm Rendi Murphree, epidemiologist and director of disease surveillance at the Mobile County Health Department. We are at our Keeler Memorial building in downtown Mobile here to give you an update on the impact of the COVID-19 epidemic on Mobile County, our residents, our visitors, our businesses. So we'll start with the world numbers. Worldwide, there's been nearly 42 million cases of COVID-19 with around 1.1 million deaths. In the U.S., we are approaching 8.5 million cases of COVID-19 with just over 223,000 deaths. And again, the U.S. is still leading the globe in the number of COVID-19 cases and deaths, followed by India and Brazil. In Alabama this morning, there were 180,916 cases of COVID-19 reported with 2,859 deaths. So in Mobile, today our daily report is providing information on 16,887. That is an increase of 2,381 yesterday, and I'll talk a little bit more about that in a minute. First, to mention that 317 have died with COVID. That's an increase of 1 since yesterday. And the cumulative number of people in Mobile hospitals with COVID-19 is 2,223. That's an increase of 11 since yesterday. Again, we're seeing most of the increases in transmission happening in younger age groups. Currently hospitalized with COVID, yesterday there were 72 people. That was flat from the day before. So we are glad to see that the average number of people hospitalized on any given day with COVID is staying in the 70s. It crept up to in the 80s about 10 to 14 days ago. So we're glad to see it back down in the 70s. So then to address the enormous spike in cases that were reported on 10/22 for Mobile County residents, I'm just going to read our statement that we have reposted from ADPH, that the Alabama Department of Public Health processed a backlog of 2,565 positive antigen results from a single facility in Mobile on October 22nd yesterday. Because these are antigen results, they will be classified as probable COVID-19 cases. And even though the tests were performed during June through October 18th, they will always show up on our reported date as October 22nd. This in no way affected patients finding out their results, right? They got their results in June or July, August, September, October, whenever they were tested. But the provider was unable to tell us about the test result, and ADPH found a way to process those reports as if they were a lab report and get them into our queue. So the facility had been reporting the people, but had not been reporting the lab test. And so again, we worked with ADPH. They were able to find a technical solution to that. So we just decided to go ahead and process the entire backlog in one day and just sort of handle the fallout and try to explain it as best we can. I do want to comment that, delays in reporting are almost never under our control. Sometimes it happens because of the facility. Sometimes it happens because of the technology. Sometimes it's human error. At our health departments, there are many points of connection that can misfire and cause a backlog of laboratory reports. And that's what happened to us yesterday. Now, processing the backlog does not impact our risk indicator dashboard. The risk indicator dashboard is calculated using not report date, but the case date, which approximates the earliest known date that a patient may have been infectious or was infectious. Usually this is the specimen collection date or potentially the laboratory test date or lab report date. But from day one, CDC has always, and we and the state have always published the cases based on the date that the laboratory result was reported and processed by the health department. So when I look closely at our numbers from yesterday, on the ADPH website, they mentioned that there were 2,564 that were processed. 119 of those were already in our system as a person, not a lab result. So there were 119 that we already knew about. We think the number yesterday reported normally that was not impacted by this backlog was around 65. So 65 new added yesterday, 68 on Wednesday, 70 on Tuesday, 51 on Monday. So the number of test results reported daily this week has been a little above average, but not as, extremely abnormal. But that large spike of 2,381 added yesterday, if you add the 119, the 65 that were real, then that brings you to the 2,565 that ADPH reported on. That was the number of results processed on that backlog. Anything else on that I need to cover? Okay. Let's see. I already covered that. All right. Some other stats that we usually talk about on Friday. We are continuing to receive complaints through iscomplaints@mchd.org, or you can email covid19@mchd.gov. This week we had 2 complaints on food establishments, 1 daycare complaint, and 1 school complaint. Also, I want to report, we've been talking about the additional, the rise in the cases that are the disproportionate rise in the number of cases in the younger populations, and we know that this is somewhat being driven by schools. So this week we have noted outbreaks at 8 additional schools throughout Mobile County, bringing our total to 9 schools who have had, who have been designated as having an outbreak with 3 cases of COVID or more. And with our long-term care facility team, we have 10 long-term care facilities that have at least 1 COVID positive resident or staff member, which it only takes 1 person in a long-term care facility to designate it as an outbreak. So 10 facilities in the last week or 2 have had at least 1 case and are now dealing with those outbreaks according to federal guidelines. And we're assisting them to the greatest extent possible. The other thing that I want to comment on today is the risk indicator dashboard. It is updated every Friday. Last week when the update came around, I think we were green in the low risk category, and we have jumped all the way to the very high risk category. And this is based on the fact that the number of cases that we have over 14 days is increasing, and the percent positive laboratory test results is also increasing slightly. So those couple of situations have put us back in a very high risk category for COVID-19 transmission.
But the new numbers have nothing to do with it.
Right. So Mark's just reminding me, the risk indicator, remember, this is the one that is not affected by the large number of cases reported yesterday because of the backlog. That backlog does not affect this dashboard. So this red, very high risk indicator for Mobile County is not due to the backlog of test results processed yesterday. All right, here are a couple of questions. Let me deal with these Facebook ones first. Someone wanting to know, is it safe to eat inside a restaurant? So safe is a very sort of black or white term, but nothing about COVID is black and white. It's not like there's a safe place and an unsafe place, right? It's sort of variations of risk, right? So eating inside a restaurant is a high risk activity because you're inside where there, are more people congregating for longer periods of time in enclosed spaces. And when you're eating and drinking, you're not wearing your mask. So that's what makes a restaurant a high-risk activity. You can lower the risk of eating in a restaurant by socially distancing, wearing your mask, insist that your server wears his or her mask properly, disinfect your table and wash your hands thoroughly after you leave. Try to keep your hands out of your face, out of your nose and your mouth and your eyes. So those are ways that you can lower the risk of COVID-19 transmission in a restaurant. But in risk terms, restaurants are high-risk locations because of those reasons that I mentioned. You sit there for a while. There are a lot of people there. You're in an enclosed space, and you are not wearing a face covering all the time because of the time that you're eating or drinking. Okay. Any updated information on whether or not a person can have an immunity after testing positive and recovering for COVID? This has gotten some press recently because CDC has said if you test positive for COVID, don't test again for 90 days, and if you're exposed, you don't have to quarantine. So this led people, including myself, people in the media, to jump to the conclusion that CDC was saying you're immune from COVID reinfection during that 90 days. Don't test, and you don't have to quarantine if you're exposed. But CDC has clarified that that is not what they intended. There is no proof that you have immunity from reinfection from COVID when the 90 days following a test. Lots and lots and lots of more to come on immunity from COVID, of course, because just how robust an immune response our body is able to mount naturally will come into play when we start seeing vaccines roll out. Because, again, vaccines boost your immune system's ability to recognize and fight those foreign infections. All right, here is a question. It's kind of a long question, so I'm just going to get to the punch. Someone has an in-law that is being treated for cancer, maybe is nearing the end of life, which of course is an unfortunate situation for everyone in the family. And the Facebook viewer is wondering if it's okay for her to visit her very ill, I think it's a brother-in-law. And it's hard to know. Certainly, these are difficult situations, but the last part of this question is there someplace I can get tested for COVID? And that is an easy question to answer. Yes, you can get tested for COVID. You can call us, 251-690-8889, and make an appointment to get tested for COVID. It will be at no charge to you, and the results will be back within a couple of days. So get tested within 72 hours of going to visit your brother-in-law. But if you test negative and you go visit, still maintain a physical distance, wear a mask, disinfect your hands, cover your cough, don't go if you're sick. Those things are still really important, even if you test negative within 72 hours of that visit. All right, here are some questions from the media, and of course they all have to do with the large spike in cases reported on the 22nd in October. How can citizens retain faith in the numbers when this many tests are left uncounted for months? Well, I've been talking about this situation and the fact that we knew it was going on for months and have said, yes, we know that there are antigen tests, point of care tests, rapid tests that are likely not being counted, but we've been receiving information on those in aggregate, and as it, by all accounts, the trends are going in the same direction. So if cases are going down and hospitalizations are going down and deaths are going down and emergency department visits for COVID-like illness are going down, then that gives me a lot of strength and the knowledge that things are trending down. Yes, the precise number, I may not know exactly, but it's really not the most important thing to me. It's to sort of know that all of the indicators are trending in the same direction, and that is what has been happening. And as I said, we've not been publishing the informal data that we've been receiving from this one location for 2 or 3 months now, but we've been monitoring it closely internally, and we're glad now that the state has found a solution for us to be able to add these numbers in with the regular reporting going forward. See, the second question was, will the tests be added to the correct dates to correct graphs and a truer measure of cases. So the graph on report date will always show that huge spike on 10/22. So just draw a circle around it and know that that is an anomaly. Today, our true number of cases reported is 65. It will always show up when we talk about the number of cases by report date. We have some other dates like specimen collection or case dates that we can adjust, and we are working to do that, to add that to our weekly report so that we can account for the original date of specimen collection or date of test for those. Let's see. Labs are required by law to report. Are there legal implications for this lab? So no, it is required by law for everyone to report, every lab to report positive and negative cases to the state health department. In the beginning, that requirement was within 4 hours, and I believe sometime in August it was relaxed to 24 hours. No, there is no penalty, no legal course that will be taken for this particular facility. In fact, the state health department has identified anywhere from 6 to 12 other facilities across the state that are in a similar situation where they have been reporting positive people through a mechanism that they thought was appropriate, and they did not realize that they were not reporting the laboratory results as well as required by law. So this is not unique to just this facility in Mobile. There will be others throughout the state, and you may see other small spikes in other parts of the state like we have seen in Mobile County. So keep an eye out for that. All right, unless something has come up, I'm going to end there. If you have additional questions, please, make a comment on our Facebook page or send us an email, and we will be happy to try to address your concerns. And we try to be as transparent as possible. We have been committed to doing that from the very beginning, and we will continue to give you updates on Facebook Live 2 days a week now, but we will talk to you on Monday. Stay safe out there and be well.